We have time for a few questions if anybody would like to take on this wonderful challenge that Harvey just laid out. So anybody want to pose a question? Actually, I will. You know, you sort of laid this out as a long-term challenge, not short-term stuff, and that we're really talking about culture change, you know, in some sort of a fundamental way. Yet, at least this effort right now, so we're looking at a 3-year period, you know, at least the first phase of this roundtable. Maybe, yes. Maybe there'll be others. We'll see how well we do. Yes. But I mean, you know, given your experience here, I mean, what might be, if in 3 years from now you came to, we came to you and said, here's what we've done, you know, yeah. You say, that's good in yes. that time period, or you fell short. I mean, what should our aspirations be in this short run, given the long run nature of yeah. the challenge?
First, I do hope that the forum will be able to articulate what the total picture and long-term needs are and requirements. And I mean that as a template against which you judge the pace and direction of progress in the near term. That is not sufficient, however. In fact, alone, that's kind of an empty success. With that, I hope the forum will be able to identify particular targets of opportunity and where there is capacity to really make progress in the next 1 to 3 years. This is a kind of challenge to be able to hold simultaneously in mind the long-term need and goal while focusing on the near-term requirement and objective. So, for example, if the forum were to say, our goal, the near term, is we are going to identify 10 institutional pilot sites that are going to mobilize the interface between population and individual care in a novel way for community health. They're not going to do yet for the nation the grand change, but they are going to introduce a model of care that integrates community and population health with individual and primary care. Now, as you know, participated, we have a report that offers some guidance about that. And the forum could say, well, one of our goals is to demonstrate that it's not just a 1 or 2 most imaginative places that can do it, but places that are prepared to take up the challenge, who have the following kinds of capacities and resource mobilization and will. We can do that. I would hope that the forum, as it looks to government action, would be thinking about both local and state as well as federal action that might be necessary, and could think together about what are the things that either can be learned or achieved by the varieties of initiative already being done in communities so that we can learn more from one another. What is it that would it take to both demonstrate and expand let's call it the SMART 10 ordinances for any community to achieve population health or to make progress in population health? And what are the 3 key measures that the forum might suggest that would help track that kind of activity? So that could be another very concrete. But these are just examples. The real test is from the thinking and creative ideas of the members of the forum, coming again from our varied experiences, being able to think together to say, you know, I think this could work. I have an idea that where we could do more with employers, or someone else said, you know, I have an idea of where it could be much more with the K-12 education system, incorporating with those who have Head Start programs. I have the following idea, and someone else might have another perspective, and I'm hoping then that the real goal is to combine a vision and a commitment and an understanding of the total problem with a very concrete set of near-term programmatic ideas and goals that the forum, working together, can make progress on.
Aren't we lucky to be based in an organization that has this kind of vision, you know, for what we're about at the top? I mean, did you have a question?
Sure. Thank you for the clarity.
And introduce yourself, please.
I'm George Flores with the California Endowment. Hi.
Hi, George.
You very eloquently express the importance of us working on a very broad issue that is about cultural change on a broad basis across all sectors. But we're a room full of health people. Is there a corollary institution in this nation that would be an appropriate forum for talking about this broad cultural change? Question one. Question two, we're a hardy band, a small but hardy band, as you said. We seem to get frequently knocked off our pedestal by non-believers and critics and those of other political persuasions that are not about social reformation or redistribution of wealth. How do we keep our spirit alive?
Well, on the first question, one of the challenges I hope for the forum will be to think proactively of how do we enlist a larger group of interested persons who do not come from health necessarily, in fact, most likely not, but who understand the importance of health for all the things that they care about, whether they're from education or in the business community, or they work in a very different agency of government-like environment related to health, but concerned also with conservation and other aspects of the health of environment, or we introduce more people with a veterinary background who can bring to the One Health concept and bring that perspective together. I think we won't succeed by insularity, and I think the answer for this task is really this forum to expand its reach and to welcome others and to bring them in as a most promising vehicle, and to do it in a spirit of genuine openness and inquiry and inclusiveness, so that you have this welcoming and appreciation of the others' contributions as well. So that's what I would say on the first question. This is the base to expand and to bring the others in. On the second question, if you're not a resilient, long-term person, you know, you're in the wrong room. I think that you know, these are not easy. These are hard. Yes, there are many reasons, many obstacles, and there, you know, it's not just again the evil foes. It's you know, it's ourselves. It's our own families, our own children, our own relatives and neighbors, and it's human nature that we're also trying to deal with, as well as the social environment, as well as the government, political, and economic environment. So, you know, that's the nature of the beast. And if we're going to go into the belly of that beast, we better be prepared for some acid.
Yes, Sonny.
Could you step to the microphone because of the webcast? Thank you.
And introduce yourself.
Sandy Magnan from Minnesota. Thank you, Dr. Fineberg. You mentioned the tobacco companies and that they are about making money. Well, Jose reminded me that the Washington Post yesterday had a headline of cancer experts battle around making money and around proton beam, you know, machines that are going to make money. We're kind of stepping into that belly of the whale here. Do you have some advice for us about this healthcare industry that has been about making money?
Yeah.
How do we change that, and how do we get the focus on, is it population health making money, or what are your thoughts around this?
You know, I was, as you were asking your question, I was reminded of what some pundits used to say in the days of Lyndon Johnson's Great Society program. They said, "At last there's money in poverty." Okay, so what did they mean by that? Is that there were programs set up in which you could do very well by combating poverty. Now, my personal inclination, and this could be a debate, but my personal inclination is I would rather find ways first to realign incentives where we can, particularly in health care, where you make more money by making the right decisions than you make by making the wrong decisions. And there's some obvious elements of this. The most obvious is fee-for-service, and the Institute of Medicine and many, many others repeatedly have talked about moving away from that model of care, of payment, of reimbursement. So that's a part of it. But also, I would say my own strategy, rather than saying I want to wean people away from the desire for material things and money, I would rather think about ways that desire can be redirected toward what would simultaneously be public and population health. And so my inclination would be not to directly confront that drive and desire, but to channel it. Find ways through incentive, regulation, sometimes law, sometimes practice, that channels that desire toward goals that are consistent with population health. So.
Okay, thank you. I think that's the time that Harvey has, and it's the time we have, so thank you so much.
My pleasure. Thank you all.
Okay. Actually, so many of these things this is what we're going to be working on and talking about. So our next presenter, and I'm looking at the staff, so we do want this, to Dr. Flores, we do want this to be not just a public health and healthcare kind of activity. The roundtable might be slightly oriented towards that, but we do have 3 business representatives and one person from United Way. So it's in the spirit of things. And as we'll learn later today, this afternoon, we have the opportunity to set up interest groups and collaboratives that actually draw those decision makers and participants from other sectors into sub-activities that we'll talk about. So I'm looking at Alina. If we're all set technologically,
thumbs up over there.
Our next speaker is, in that spirit, our next speaker, who's not here because she's here on Skype. You just heard the little, she's Kathy Bazzi, who is the Chief Health Officer of Dow Chemical Company. She has direct responsibility for leadership and management of all occupational health, epidemiology, health promotion programs and staff around the world. She's a key driver of the Dow Health Strategy. She can't be with us today because she's actually leaving this afternoon on an international month trip with the Dow facilities around the world. But I did want to have this panel reflect that perspective, and at least in my personal experience, there's no one thought more about it and had more experience in it than Kathy. So, Kathy, are you there?
Hello. Let me just do a sound check. Are you able to hear me?
Actually, that's terrific, and thanks so much for joining us, albeit remotely. We look forward to having you in person in future meetings.
Up there in the little corner there.
Oh, I guess we have your picture up in the little corner. Okay, so, and Kathy, we've already had a wonderful welcome and framing from Dr. Fineberg, and an opening presentation from Steve Teutsch on the health dividend and some of the challenges for reorganizing our resources. So thanks for being here, and